Let me just start by thanking everyone for being here today. Hey, John, how am I doing? When we started, Stephanie Rawlings Blake was the mayor of Baltimore, and when we went to her with the idea of creating a task force on addiction and recovery services, and she was absolutely all in at the time. And our first meeting was probably 15 people at the table. And then it grows every single time. And any of you who had a chance to hear Chris Herron just speak, I think everyone in the room could identify with his story one way or the other. Maybe not personally, but you could identify in challenges and struggles that our family has, or a constituent has, or somebody has. And I think what Chris's message today is something that we need to continue as mayors to talk around the country. There's a lot of stigma with addiction that's out there still, and I just think we have a real opportunity here to do some incredible things. We have some incredible speakers here today, and we're going to turn it over to them in a minute. I want to just say a couple things. I want to thank, I don't know if Nan's here, but I want to thank Nan Whaley for being the co-chair and doing some incredible work. In 2017, in Miami, we had a Narcan training, and we started the recovery toolkit. So what that means is any new mayors at the table, we have a recovery toolkit that we can get you to help you in your cities and what we're doing here, and best practices around the country, quite honestly. In 2018, San Cointes and Vanique Murte spoke, and he wrote a book called Dreamland that was absolutely incredible. And if you really want to understand the opioid crisis and the heroin, not the beginning of it because it happened before that, but if you want to get a good grasp of what we're battling with America right now, get the book Dreamlands. It's an incredible pathway to how heroin really peaked here in America, but also how and what happened in Mexico as they were sugarcane farmers turning into poppy seed farmers, and at the same time talks about the 1850s of opioids when they started and how that evolved into something special. So I would suggest you get that. The national conversation has certainly evolved. People are talking about addiction and disease. People are talking about medication-assisted treatment. People are talking about alternatives to prison and jails, et cetera. And, all of those work, but I do think that it's important for us. We can't just be a society that's about medically assisted treatment. We can't just do that. I mean, that's not going to work. We have to have some other recoveries there as well. We need to remind people that we need a full continuum of care. What that means is when somebody goes into detox, they have access to detox, and then when they get into detox, they have an opportunity to get into a long-term living situation if they need it, something we have to work on. It also talks about prevention, and I think Chris Herron touched upon that today. We have to do a better job of prevention as well as long-term recovery. Our speakers today are going to demonstrate the range of interventions possible at each curriculum point. The key themes of the conversation today: innovation, collaboration, equality, and I think we'll have a good conversation here. Before I turn over to my first speaker, I'd like to just take a minute, if we wouldn't mind going around the table and introducing the mayors, if the mayors could introduce yourself. But I have three people here I want to introduce myself. One is we created the Office of Recovery Services, and we have an area of Boston that there's a lot of services, and there's a methadone clinic and a homeless facility there, and we have a lot of police issues there, and we have a deputy superintendent for the Boston Police Department that is doing an awful lot of work with the providers and with the community and with the police, and we're doing a lot more training with the police. Deputy Superintendent Winnie Carter's here today. I want to thank the superintendent for being here today. We also have John Rosenthal, who was the founder of Stop Handgun Violence and working. He's here. I think it's a different role today, but we'll hear from John in a little while about his role. And I want to thank John and Allie for being here as well today. And then I talk about prisons in my introduction here, and we have an incredible sheriff in Suffolk County, which is majority Boston, and then 3 other towns outside of Boston. And his whole role has really been about making sure that the people that visit him through the courts, when they leave, they're better than they came in. And he's done an awful lot of work in that area with reentry. And he just launched a program the other day that is really diving into recovery in prisons, not just simply a couple AA meetings a week or a month, but really doing more than that. And that's Sheriff Steve Tompkins. I want to thank Sheriff Tompkins for being here today. And I have two speakers that are going to speak. The first person that's going to speak is the Health and Human Service Chief for the City of Boston, Marty Martinez, and Marty's going to talk about youth prevention efforts in our city as the Secretary of Health and Human Services. And then joined by Marty is Dana, right, Dana? Danae Barg, who's a graduate of the 2015 Osterguy High School, Recovery High School in Boston. And I'll tell you how this works. This works in Massachusetts. We didn't have recovery high schools, and we saw what they were doing in Minnesota. And we went to Minnesota, and Steve Tompkins, Steve Tolman, was a state senator at the time. He runs the AFL-CIO right now. Willie Osterguy, who's a firefighter EAP, and Kerry Healy, Lieutenant Governor of Massachusetts, who was a Republican. And I say that because it's important that this is not a Democrat-Republican disease. This is a disease. And they came back, and we filed legislation in Massachusetts to create recovery high schools, and now we have one, and we have a graduate of the 2015 class. So I'm going to turn the microphone over to Marty Martinez.
Thank you, Mayor. You know, one of the things that we've been looking at when we talk about, this disease, we focus a lot on recovery. Obviously, the mayor's leadership created the Mayor's Office of Recovery Services, first in the nation, whose director, Jen Tracy, I think is here today. And through her leadership, back here, through her leadership, been able to really do some amazing things around the epidemic. From distribution of Narcan, creation of an engagement center, better partnerships with public safety, really doing more to bring the disease out of the shadows on the municipal level. But when you look at this issue on all levels, you got to look at prevention. When you think about the continuum of care, yes, recovery services are critical, access to beds, access to resources, but we all know that in any health and human service issue, the more we spend and the more priority we place on prevention, the more we get our return on investment. And we ensure that prevention services and resources can help us counter some of the issues that we're facing on the local level. And so what we did recently, and we want to highlight this for you, in your packet there's a one page for the mayors to see related to a youth substance use prevention strategic plan. And what we did is the Office of Recovery Services partnered with Blue Cross Blue Shield here locally to sort of say, let's understand what are the prevention-specific issues that impact young people in our communities. What are those issues, and what can we do to sort of elevate this work? All while at the same time focus on recovery, focusing on treatment, focusing on access to care. How do we make sure that we start at the beginning? And you heard Chris Herron sort of talk about that. Through its entire journey, come back to what's those prevention messages that are there, and how can we focus on it? And so we sort of elevated a variety of issues that came up through the voices of young people, CBOs, community health organizations, schools, and really tried to understand what are the unique issues facing youth, what are the unique issues facing our systems, and how do we ensure that we put in resources around prevention. And so what we did is, and we haven't released this report yet, it's going to be released here shortly in a couple weeks, but what we basically did is said there's 5 broad strategies that we know is important when we're thinking on a municipal level around prevention as connected to this larger continuum of care. Expanding leadership and coordination was the main one. It was how do we make sure that there's not a bunch of stuff happening in a bunch of places, but how do we use not only the leadership of the mayor, but the leadership of trying to raise up these issues in the community to have better coordination. So one of those strategies will be to create a coordinated youth substance abuse prevention task force that will help us create more coordination on that level and ensure that the resources are connected. We're going to increase prevention work in all city agencies. So obviously we have over 150 public schools in Boston, variety of different services and programs happening there. How do we ensure that we have better access to data that will tell the story from our schools? Looking at our Boston Centers for Youth and Families, 36 facilities across the city, how do we ensure that those programs that are happening in every neighborhood include prevention as well? It also includes consistent messaging and ensuring that we're talking about prevention in all places. I talk a lot with CBOs, and we've talked about this, where we say that you'll talk to a CBO and they'll say, our community-based organization, and they'll say, well, we don't do substance abuse prevention work. And I say, if you work with young people, you're doing substance abuse prevention work. And we have to do a better job of ensuring organizations understand that and their connection to us and their connection to those resources. It includes pathways to care, obviously, in different avenues, as well as better engagement of the academic and philanthropic sector. This prevention report, to be honest with you, isn't groundbreaking. It tells us what a lot of things that we already know. But what it has done, and what's unique for us in Boston, is it's sort of raised the question, when you think about substance use abuse prevention issues for young people in Boston, we're talking predominantly youth of color, what are some of the issues that are impacting there? So as we're battling the opioid epidemic, we have to remember what alcohol and marijuana use looks like within young people, within communities, the impact of trauma when people are dealing with violence, the impact of some of the challenges that our neighborhoods experience. And so when you think of prevention and you think of youth, we got to think about the full continuum of the epidemic of substance use. And what does it mean and how do we create resources to do that? So that's really about ensuring that programs and resources meet young people everywhere they're at, every community they're at, and within every population that might be engaged with. And that's what we're trying to do in Boston, and using the leadership of the mayor through this Office of Recovery Services, but to raise up prevention. It's got to be part of the conversation, not an also had. It has to be central to how we think about this continuum. And so I can't think of no better way than to think about that continuum when we think of schools than to hear from Danae, a graduate of Ostagai High School, where I had the privilege of speaking at just last week, and to really be able to understand what does it mean to have not only that continuum, but have the messages and the services be handily and readily available for all young people so they get their needs met and we can sort of tackle this epidemic from multiple stages. So let me now introduce Danae and have her tell you a little bit about her experience.
It's the second squiggly line from the right.
Can you hear me? I've never done this before. Hi, my name's Danae, and I'm a 2013 graduate of Ostagai Recovery High School. So a little bit about like where I come from. Like, I'm from South Central Massachusetts. I grew up in this town where there wasn't a lot to do besides drinking, use substances. And it was fun until it was no longer fun and it became a problem for me. And I found that from bouncing from public school to public school, trying to work on the problem that I had with substances, I wasn't receiving kind of like the help and the attention that it was needed as. It was kind of brushed off as I was young and it wasn't that serious, and to get back to class and like it'll pass. It was a phase. It was looked at, and so there wasn't a lot of support. There were 3 guidance counselors for 500 plus kids in a school. You know, it's not as individualized. And so I was introduced to Ostagai Recovery High School through the Cushing House in South Boston and the Gavin Foundation. I was 18 years old and I had dropped out of high school and I had like 3 more credits to graduate and I just didn't have the motivation. And so they kind of lit the fire for me to be like, you need to go back. It's something that is achievable. And there, once I entered Ostagai, so many doors have opened for me. And I say this with so much gratitude for where I came from, because if it wasn't for Ostagai and the guidance counselors and Roger, the principal, like, I wouldn't be where I am today, having like this magnificent life that I have. And so what it looks like at Ostagai is it's a very positive learning experience. Like, the class sizes are less than 20 kids a class. You know, you get the academics that you need, but you also get like the attention that you need. And you, like, if you're having an off day, people are gonna notice. And so the principal, the guidance counselors, the recovery counselor, it's all very, I can't say it enough, it's very individualized. And so there's a lot of access to treatment. You know, there's random drug testing as well as weekly drug testing to kind of keep you motivated to doing the next right thing. And it's enjoyable, you know, like, I liked going to school for the first time in a long time. And to be able to complete my senior year in that kind of an environment was, it was really great. And so we had recovery groups, we had peer groups. It's very peer driven as well as staff driven. And so kind of having the support, whereas you're not just another face in a crowd at a regular high school. Sorry, I'm using notes. And so now what it looks like is, having graduated at 18 and now being 23, I visit regularly. I chaperone their prom, which was really cool. And people still look forward to seeing me. You know, after I graduated, I had the opportunity to attend Northeastern University, and that was really awesome. I struggled, and I relapsed after because of like the lack of it's the lack of the support and transitioning from high school to college and like having the city of Boston in the palm of my hand. I didn't know what to do, and so that was really difficult. And so I don't know. I ended up back at the Cushing house at 21 years old, and I've since been sober. I'm coming up on 2 years, and like I said, like a couple weeks ago, I was able to chaperone the Ostagai prom as well as all the other recovery high schools. We had Independence Academy, and we had there was another one, and I can't think of it. But they were all there, and I was able to be a part of that, and I was able to be a woman of sobriety and attendance and be like, I had a student say to me, like, you make me want to be sober and to stay sober, you know, and it's something that's achievable. And just because I'm 23 years old and I don't drink, like, I still have a life and I'm still able to give back, and like I'm so grateful, and like I'm positive and I'm healthy, and like I keep in touch with everyone at Ostagai, and like my life moving forward as a young woman in sobriety, like I don't think that I would have some of the opportunities that I do if it wasn't for Ostagai Recovery High School. And like I'm enlisting in the Navy, and like my life is just like opening up in abundance, and like I am just so blessed and grateful for like the life that I have because of Ostagai Recovery High School. And thank you so much for having me here.
Great job. That was awesome. Thank you. And just so for those at the table wondering what the Cushing House is, I should have explained in the beginning. Cushing House is a recovery program, recovery home that was started in Boston probably about 15 years ago. Started with boys, 28 boys for teenagers, and then now 28 beds for girls. So it's for teenagers. So when we have young people that are looking to get into recovery, rather than have to go into an adult home, which the challenge is a little different, we have them into a younger person's home, usually ages 15 maybe to 21, 22, around there. Right? Well, 15 to 22. Before I introduce Mayor Ginter to speak from Columbus, I forgot to do this. I'd like to go around the table just to introduce those of you that represent mayors, and if you're representing your city. So if you could go around, we'll start to my right, my friend.
Andy Ginter from Columbus.
I'm Winnie Carter with the Boston Police.
John Rosenthal, Police Assisted Addiction and Recovery Initiative.
Allie from Pari.
Steve Tompkins, Suffolk County Sheriff.
Kent Gwynn, Ocala, Florida, Mayor of Ocala.
Jim Dunges from Nashua, New Hampshire.
Bill Dush from Concord, North Carolina.
Heidi Williams from Thornton, Colorado.
Bill McLeod, the Mayor of Hoffman Estates, Illinois.
Rich Feenstra, Mayor of Addison, Illinois. John Mitchell, Mayor of New Bedford, Massachusetts.
Bill Carpenter, Mayor of Brockton, Massachusetts.
Gary McCarthy, Mayor of the City of Schenectady, New York.
Kirk Caldwell, Honolulu.
Nancy McFarland, Mayor of Burlington, North Carolina.
Mayor Ted Green from the City of East Orange.
I'm Alfredo Ortega from the City of Doral, representing the mayor.
I am Nusha Gailey, one of the co-founders of BioBot Analytics.
I am Mariana Matus, one of the co-founders of BioBot Analytics.
Any other buddy representing your city here?
Mayor.
Bloomington, Indiana.
Any other mayors? Yeah.
Lakewood, Florida, Vice Mayor.
All right, thank you very much. Now I'm going to turn the floor over to my good friend from Columbus, Ohio. A topic is going to be talking about joint county initiatives and overdose responses.
Well, thank you very much, Mayor Walsh, and for you and Mayor Whaley's leadership and vision in putting this task force together and leading this important work for the U.S. Conference of Mayors. The country, as everyone knows, is in the middle of this opioid epidemic, and Columbus, in the middle of the country, has hardly been immune from that. Central Ohio saw more than 500 overdose deaths last year. There's almost 2 people dying every day, and a 47% increase from 2016, probably what many of you are seeing in your cities as well. In our community, more than 4,300 residents are active heroin users every day, and many of them begin their road to addiction right in their own medicine cabinet. We all could be one surgery or one injury away from the brain disease of addiction, and addiction can and does happen to everyone. The current wave of overdoses is being impacted in Columbus by fentanyl, a powerful synthetic opioid that's being laced in other drugs such as cocaine and meth. Often the users don't know fentanyl is in the drugs they are using, and sometimes the sellers use fentanyl as a marketing tool for a better high. So in the last 4 months of 2017, 75% of unintentional overdose deaths involved fentanyl in Central Ohio. And these are pretty stark statistics, and there is no doubt this is a public health crisis in our community and communities around the country. So our approach, our thought was, if we've used the Columbus way, which we pride ourselves on public-private partnerships, we think we do them better than anywhere in the country. My guess is the mayors might have some different arguments about that, who do them exceptionally well. But if we use that to help revitalize our downtown and to help win the Smart City Challenge, shouldn't we use that same culture of cooperation and partnership in tackling one of the biggest public health crises of our time? So almost a year ago, we implemented the Franklin County Opiate Action Plan that really has 4 overarching goals: preventing opiate abuse and addiction, reducing the number of opiate-related deaths, expanding access for treatment, improving safety in our community. So to do our work best, we have to be grounded in the understanding that heroin addiction and opiate addiction is a chronic, relapsing brain disease. Our goal is to help people who are already addicted and prevent people from becoming addicted in the first place. So through our city's public health department, we're working to increase access to medication-assisted treatment, including a new program that we will offer, where we will offer Suboxone as well as Vivitrol to assist clients into recovery who suffer from substance abuse disorder. Increase the overall access to naloxone through first responders and other partners in the community. Facilitate comprehensive harm reduction programs that include addiction assessment, naloxone availability and education, treatment, referral, and access, infectious disease testing, syringe access and exchange programs, and education and support. We're also working to provide data to understand the scope of the epidemic and to improve our systems to track trends in the opiate use and associated impact. Like the disease, the epidemic is complex. It's going to take all of us working together in our community, including leadership from the private sector and our ADAM-H boards, alcohol, drug, mental health addiction boards that are administered at the county level in the state of Ohio have been incredible partners. So we've just started a pilot program with text strips for users to detect fentanyl, which can help prevent accidental overdoses. The test strips are being distributed throughout the comprehensive harm reduction program that we administer. They're also provided along with risk reduction counseling, access to naloxone, HIV, hepatitis C testing, referrals to behavioral and medical care, alcohol and drug referrals, and clean syringes. We have found that a high percentage of those who use our harm reduction program get into treatment within a year and begin the long road to recovery. Another success story for us in Central Ohio is the opening of the Maryhaven Addiction Stabilization Center. Maryhaven is one of the county's oldest and most comprehensive addiction treatment providers. They stepped forward to open a first ever addiction stabilization center as part of our fight against opioid addiction. Our emergency rooms where our first responders were taking addicts, and oftentimes those folks were returning right to the streets and even checking themselves out. There was nowhere for them to go, and there was nowhere for our first responders to take them. And so this Maryhaven Stabilization Center has been a huge benefit and move forward for our community and for our first responders. They provide crisis care to individuals recovering from overdose and encourage patients to immediately enter treatment. The center offers withdrawal management services or detox, post-detox residential care for up to 30 days. So it's the beginning of a holistic, comprehensive care of this disease as addiction. We know that this holistic approach can bring the best success in treating disease, as they have with cancer and other major diseases that we face as a community. Acknowledging and treating it and continuing to remove the stigma, as Chris and Dia and others that share their story. We know that Mary Haven is going to bring that model to addiction treatment. We're looking to expand and add stabilization centers to other neighborhoods that have been disproportionately negatively impacted by the epidemic. And as I mentioned before, one of the key pieces to our effort has been the public-private partnership and leadership. We're blessed to be home to Nationwide Insurance, and their CEO, Steve Rasmussen, over a year ago decided that this was going to be an issue that he and the company were going to take a significant leadership role in. So over a year, Nationwide knows a little bit about marketing and research and so forth, and they put their best and brightest and did a significant amount of research on leading a prevention and education campaign in Central Ohio. That will launch on June 18th. And what their data and research demonstrates is shocking. Nearly 70%, 69% of those parents polled and that were part of focus groups and discussions believed that opiate addiction was one of, if not the biggest crisis facing the community. But only 17% of those same parents felt equipped or empowered to talk to their kids or thought their kids would be affected by it. So that is the focus, and the real target of the campaign will be around the parents of preteens and teenagers to really go after, as we've talked about here today, and Chris, such a powerful tribute and story that he shared with us earlier. But prevention and education is where we are going to continue to focus our efforts as we continue to expand addiction and rehab services, but a place that we're grateful for the leadership of our private sector, and a place that I think private sectors and communities around the country need to step up and take the lead on. So, Mayor, thank you.
Thank you, Matt. We have two more presentations, then we're going to have a conversation. Anyone has questions, so just be ready. The next topic is data and early detection of substance abuse disorder in urban areas. Co-founders of BioBot Analytics. We have Mariana and Nusha. Let me turn over to you guys.
Thank you so much. Thank you, Mayor Walsh, for having us here. I'm Nusha Gailey, one of the co-founders of BioBot. We're an MIT spin-out. We're located just across the river in Cambridge, Massachusetts. And we're developing a new standard in order to assess the opioid epidemic. And we're doing that by measuring the concentration of opioid metabolites in our sewage system. We're doing this because we think that there's better data that we can have in order to equip those focused on treatment and those focused on prevention. And we're actually not the only ones who think this. Is this working? Yeah, perfect. Michael Bloomberg said earlier this year that he believes that better information could help communities, states, and the federal government monitor the scope of the crisis and target interventions more effectively. And earlier, last year in November, the President's Commission on Combating the Opioid Crisis put forward several recommendations on how to expand surveillance on the opioid epidemic in our cities, and one of them was actually wastewater testing. And so at BioBot Analytics, that's what we're facilitating, because urine, which is collected in our sewer systems, is actually a rich source of information on what we're consuming. And this is all aggregating in sewers, public infrastructure that's owned, that's managed, and that's maintained by cities.
And so the concept behind our work is simple. Actually, the implementation is not that straightforward. It requires the cooperation of a bunch of engineers and scientists and technologists together with the government to be able to create this novel, unique type of data. So here at BioBot, what we have done is creating a full service solution for municipal government to be able to leverage wastewater as a window into population health. It starts on the ground with collecting samples from manholes. Here in this picture, you can see Herbie, who works for the Cambridge Public Works Department. And each time Herbie wants to collect a sample, it takes him 10 minutes to deploy our box and then get it out the next day and send it back to our lab. In our lab, we have a dedicated group of scientists who then do a chemical analysis to look at different drugs. And we show the results in a report form to our customers. And what this report shows is the collective consumption rate, so how many milligrams of a drug were consumed per 1,000 people per day in a certain region. And we can look at illicit drugs such as heroin and fentanyl. We can see prescription drugs such as oxycodone and codeine, medication-assisted treatment like methadone and buprenorphine, and Narcan. This intelligence helps you know exactly what's happening locally in your city. You can then decide how to redistribute resources. You can choose what's the best program to deploy in your city, and you can evaluate how effective your response was.
And now this data is consumption data that's representative of the entire population that's living with opioid use disorder. So we're not just counting overdoses or measuring extremes that represent a small number of people. It's consumption data that's not regulated because it's naturally aggregated and anonymized. It can be easily shared amongst multiple departments in the city. And it's also a single source of data, from multiple types of drugs. So that's just a single contract that's executed by the city. And finally, it's really a tool for community engagement and reducing stigma on opioid use disorder. And this is something that the cities that we're working with are really excited about. We've been working with Cambridge, Massachusetts for the last several months now on developing the technology. We're now live in Cary in North Carolina, who was actually selected as a champion city as part of the Bloomberg Mayor's Challenge to implement this solution. And we're hoping to expand to about 4 or 5 more cities this year in 2018.
And here you can see Mike Bajorek. He's a deputy town manager in Cary. And Mike supported this project because he believes that this technology will help make Cary healthier, a healthier city. And he sees the potential of this technology. Beyond opioids, as we were saying, there's other problems that affect the health of residents in a community. And with this technology, we can look not only at opioids, but also at infectious disease, antibiotic resistance, nutrition, and exposure to contaminants, as well as other substances like alcohol and tobacco, to really understand what's the effect of government policy. This type of technology has been implemented in Australia, the European Union, and more recently in Canada at the national level. And our standards are based and improve on the methods that these countries have used, thanks to work done over the past 5 years at MIT. I started this work as part of my PhD. It was a big effort that was actually supported very early on by the city of Boston. And after securing a large grant from an international organization, we created a collaborative research project between 6 labs at MIT. And that moment is when I met Nusha. So I was the scientist, the biologist, and Nusha brought her expertise in smart cities, in architecture, in urbanism, and together we worked for 3 years as research collaborators at MIT, implementing studies in the Boston area, in Kuwait City, and in Seoul, South Korea. And we were really inspired by the potential of this technology, and we decided that we wanted to be the ones that bring this science to every city across the US. So we're BioBot Analytics. We are out of MIT. We're academics. we're really excited about using our skills and our technology to empower you to really tackle and stop this epidemic. Thank you.
Thank you.
Thank you. We had some fellows in the office that brought this to me in the very beginning a couple years ago, and I thought they were crazy. And then they started to explain about finding out high uses of different drugs, heroin, fentanyl, really, when talked about at the time, in different neighborhoods. You'd be able to tell what neighborhoods in the city of Boston might be using certain types of drugs in the city, in any of your cities, for that matter. So we're in, so you have 4 cities left. The next conversation, and then we'll open up for questions, is the Police-Assisted Addiction and Recovery Initiative. John Rosenthal is the chair. Allie Hunter McDade is executive director. And those of you that don't know John Rosenthal, he is also responsible for starting the program Stop Handgun Violence, and has done incredible work in the philanthropic world, always around helping and assisting people. So I'll turn it over to you guys.
Thank you so much, Mayor Walsh, for having us and for the opportunity to present here to all of you. Thank you, John. So we're piloting a new program to place recovery coaches with Boston Police Department. And, you know, we couldn't do it without the leadership of the mayor. So thank you for believing in this work, believing in the power of the recovery community, and for making the opioid epidemic a top priority. I also wanted to thank the Massachusetts Service Alliance and the Corporation for National and Community Service. Last year, the corporation put $10.5 million into opioid-related programming, and so at a local and a federal level, they're making the opioid epidemic a top priority as well. Lastly, I wanted to thank all of you guys for being here today at this session. I know there's other sessions you could be at, but being here means that you want to think about what you can do as mayors to respond to the mounting opioid epidemic. And I did want to make sure I recognized Mayor Carpenter from Brockton and the mayor from New Bedford. They're leaders in this space as well. They could be presenting. So I wanted to make sure they got a little shout out because they're doing amazing work in this realm as well. So again, I'm Allie. I'm the executive director of PARI, and like most people, this is an issue that hits close to home for me. I have a close family member in recovery from an opioid use disorder, and in my role at PARI, I'm really honored to work with police departments that recognize addiction as a disease, not a crime that needs treatment, not jail. So PARI was founded about 3 years ago, just over 3 years ago, and since that time, we've become a movement of more than 400 police departments in 32 states. And what PARI does is give these police departments the tools, the training, the technical assistance, and the resources to create non-arrest pathways to treatment. So last spring, I started working with the Massachusetts Service Alliance to develop the project that we're here today to talk about. And like I said, this is a focus for Americorps and for national service on both the local and federal level. We've seen that police have a front row seat to the opioid epidemic, and they're in a unique position to help people take their first steps on their recovery journey. So the program is really about placing service members into police departments to prevent overdose deaths and help people access treatment. So we have 22 Americorps service members supporting 53 police departments across Massachusetts. And their goal is really to help build the capacity of those law enforcement agencies and directly help individuals who are struggling with an addiction, either themselves or the addiction of a loved one. Each program utilizes the members a little bit differently, but we're going to mostly talk about our program here in Boston. To start, I wanted to recognize the 5 Boston-based Americorps recovery coaches. They're all sitting over here. If you guys could give a wave or stand up. So they're working with Boston Police Department as recovery coaches, and recovery coaches, in short, what they do is they make referrals to treatment. They help people navigate recovery support services. They remove any barriers that somebody might encounter. And maybe most importantly, they provide hope and optimism and encouragement for somebody so they know they're not alone. So there's 4 primary ways that somebody can access and be connected to these recovery coaches. One is that they can get a referral from a Boston police officer who sees somebody struggling and thinks they could benefit from a recovery coach. 2, they have drop-in hours at Boston Public Libraries. So somebody could drop into one of 5 Boston Public Library branches and have a conversation with someone and get their support. They could self-refer by reaching out to the coaches directly. I gave everyone one of these little cards. This is basically what we have spread across the city. And anybody who has a card like this, anybody who learns about the recovery coaches can just reach out to them directly at any time. They also do active street outreach, trying to find at-risk community members and offering their support. So 2 things I wanted to focus on. One is cross-collaboration. This is a key feature of the program. We're partnering with various city agencies like the libraries, the Mayor's Office of Recovery Services, Boston Public Health Commission, and of course we're also partnering with treatment centers, with hospitals, with neighborhood associations, and organizations that provide related services such as housing. We also really put a focus on equity, inclusion, and diversity in this program model, both in terms of the members and in terms of the program services. So right from the jump, we wanted recovery coaches, the ideal profile of a recovery coach to be a person who's personally in recovery. So we're reframing that experience as an asset. It's no longer something that might be held against you in a job interview, it's now an asset. Also, we're prioritizing passion and lived experience over educational and work experience. And we're actually investing in our members so that this is a workforce development pipeline, and after they complete their year of service, they can go get meaningful jobs in this field. Also, we're trying to make these services available in different parts of the city. In Boston, we're really lucky. There's a lot of support services related to recovery, but sometimes the services are mostly concentrated in certain areas of downtown. So we wanted to make these services available out in neighborhoods that have less current access to services. And I'm happy to report we achieved these goals, and we have a really amazing team. Everybody on our team is from Greater Boston. Actually, 3 out of 5 members are supporting the communities that they themselves grew up in. Everybody's personally in recovery and has direct experience navigating the treatment systems here in Boston. So that's how it's going so far. It's a really new program. We're excited to share more as our program develops. I will share on a state level, since we started the program in October 2017, we've helped over 3,000 people, unique individuals who are affected with substance use disorders. And 100% of the police departments that we're working with have reported that they feel the members have improved their program efficiency and effectiveness. So that's kind of a program snapshot. I'm going to turn it over to John Rosenthal.
Thank you.
Yeah.
Mayor Walsh, thank you for being an amazing partner. So, Marty Walsh is a pretty unique individual who is as compassionate as any elected official I've ever met, and runs an amazing city. And we have partnered on homelessness prevention through Friends of Boston's Homeless, Stop Handgun Violence, gun violence prevention. I'm a gun owner, and we've created this nonprofit. We've enacted laws, and as Boston goes, so goes the state. And I know we're not here to talk about gun violence prevention, but it is another bad public policy that's leading to bad public health outcomes when you can go to 30 states and get guns without an ID or background check. We are an urban state. We have the most effective gun laws. We've reduced the rate of gun deaths in Massachusetts since 1994 by 40%, and we have the lowest gun death rate in the nation of any state. So we've kind of proven that gun laws work. And again, as Massachusetts goes, it's really dependent upon our big cities. So gun violence prevention has made a huge difference without banning anything except for military-style assault weapons and large-capacity ammunition magazines, the common denominator in the daily mass shootings. So, but we started that effort by working with law enforcement and the conservative voice of law enforcement, and it was successful. So using that model as a business person who's constantly working with the city in a partnership environment around homelessness and gun violence, we started the Police Assisted Addiction and Recovery Initiative in June of 2015 in the city of Gloucester, a community of 28,000 people. There were twice as many overdose deaths in the first quarter of 2015 as the year before, and our police chief said we can't arrest our way out of this, the disease of addiction, or at least a chronic disease without a cure. And he was always arresting and rearresting and then saving and then taking people to the morgue. And he said to the mayor, we've got to try something different. So starting on June 1st of 2015, we said anyone with the disease of addiction could come into the Gloucester Police Department with or without their drugs and paraphernalia and get into treatment, pre-arrest, no shame, no blame, treatment versus jail. And we did not know how many people would show up. Since June 1st of 2015, in the community of Gloucester, we've placed over 600 people into treatment. 300 treatment centers across the country have joined our effort, and across the country, now 411 police departments in 32 states are providing pre-arrest access to treatment for anyone with disease of addiction, and we have placed, since June of 2015, over 15,000 people into treatment through police departments. This is like man bites dog. This is, you know, the conservative voice of law enforcement saying we cannot arrest our way out of a public health epidemic. And we started by equipping every police officer with Narcan. Then we started equipping families with Narcan. We have two primary models. One's the Gloucester police model, where welcoming people into the station 24/7, like an emergency room. Police departments are open 24/7. Unlike emergency rooms that pretty much, you know, shame, blame, and kick you back to the street to die, the police are providing pre-arrest access to treatment same day. One thing that we didn't realize is how many treatment centers would want to join this effort too. So 300 treatment centers are on a list. So if your chief or you mayors decide you want to do a law enforcement-based pre-arrest access to treatment program, we provide you with a list of 300 treatment centers who will take anyone the police call with or without insurance. So we have also found that these treatment centers, like all of us in the general public, and probably even you mayors before you became mayor, you kind of are, it's ingrained in you to not say no to police officers. So when a police officer calls a treatment center people are the same way. So whereas we have all experienced addiction in our families, I don't think anyone's immune any longer. And 65,000 people will die or more this year. And if it weren't for Narcan, that number would be 5-10 times more. I mean, in the city of Gloucester, we had 2 to 3 saves. We still have 2 to 3 saves every week. The city of Boston has 2 to 3 every day. Saves. Imagine if Narcan weren't in the pockets of first responders. So it's not complicated. This is a disease that was largely created by aggressively marketed and overprescribed pharmaceutical drugs. 80% of people who end up with heroin use today start with legally prescribed opioids that were misrepresented back in the 90s as not as addictive as they are. And now we're starting to see, as the numbers are showing, roughly 70-80% of people who overdose today will have fentanyl mixed with their heroin or cocaine. So there are only 2 options for you all, and all of us. It's long-term treatment or death with the disease of addiction. And it has been allowed to run rampant for decades because of the stigma, shame, and blame. And the fact that law enforcement has changed the conversation, and if the police in your community and the mayors, and you want to do this, you will be amazed at the community response. So we didn't realize, you know, we didn't know how many people would come in. And we say if you relapse, come back. We also have come to the conclusion that, you know, Congress listens to law enforcement differently too. And so we were a part of, the White House brought us a number of times in the last few years to help Congress enact billions for, $1 billion for treatment. It's going to take many billions, but in the meantime, until there is a long-term treatment system like exists for cancer, heart disease, or diabetes, we are going to continue to lose 150 Americans a day to this epidemic that's largely preventable. So we need a long-term treatment system like exists for every other chronic disease, and law enforcement are leading that effort. We only have 411 law enforcement agencies in 32 states. We need the thousands, And you will also find in your community that you will save money because it is much less expensive to get someone to treatment than into jail, transported back and forth. And you will see a reduction in crime. We've seen roughly a 30% reduction in ancillary crimes associated with addiction, like breaking and entering, smash and grab, and shoplifting, because these are folks that when they are cut off with their doctor for an Oxy 80, it's $1 a milligram on the street. That's $80 a pill times 4 to 5 to 10 a day. You go broke and you go to cheap heroin and fentanyl. So this is something that is going to be a part of all of our lives for many decades, but we've got to create a treatment system that's blind to this disease, and law enforcement has started that effort, and the more mayors and the more law enforcement join, the quicker we'll get to that long-term treatment system.
Thank you, John, and thank you everyone for presenting. We have about 5 minutes left because I know people have other conversations they have to go to, so I'd love to open up for mayors, and then we're going to have a quick swearing in of our recovery coaches right after. Yeah.
Okay, thank you, Mayor Walsh. What you just got through saying we're doing in Ocala, but I didn't know about your program until I sat down here and started reading your information. I went, wow, we're doing that. But, I talk about this task force when I get back home and all the great ideas that come from this group here. And one of them that we are doing is the amnesty program. We recognize that we did have a problem. We started a task force, but our chief said, let's do the amnesty program. And we've done it. We've had, I think, 10 people walk in and said, I'm done. I can't do this anymore. And then we partner with the rehab facilities that they guarantee that they will treat them, through the detox and rehab if they need that. And, one of the things you said was on point was we had a gentleman the other day that came in and he goes, look, he said, I can't do this anymore. I can't live like this. He said, I may be a drug addict, but I feel like I'm going to rob someone and I'm not a thief. I just need some help. And he walked in off the street. We have a sign out on front of the police department that says, you can come in and do that. We also did the Narcan, which has helped tremendously. We've saved a lot of lives through that. I won't go into the numbers, but you can imagine they're significant. So, but I wanted to thank this committee. Thank you, Mayor Walsh, for this group. And the ideas that we've come up with came directly from this group here. So I want to thank you.
It's great to hear, Mayor. Thank you. Mayor? John?
All right, well, thanks, Mayor Walsh. Thank you, everybody. John Mitchell, Mayor of New Bedford, Massachusetts. Let me just start off by saying, Mayor Walsh, that it's at the risk of sounding ingratiating, you guys have done a hell of a job in leading the country on these issues. So the level of sophistication and determination that has made a difference in a lot of places, including my city, which, every time we've talked about, either with you directly or your team, we've pulled away something new that we can take back home, so it's really good. For our part in New Bedford, we're a city of a sixth of the size of Boston, and we have 2 to 3 saves a day, and ourselves, and we were one of the first communities to arm everybody with, every first responder with Narcan, and you're right, we would have the bodies would be piling up if we didn't have Narcan available. Through our Greater New Bedford Opioid Task Force, which I formed a couple of years ago, we've tried to take a multifaceted approach that includes all the things that we've talked about beyond Narcan interdiction. We have a DEA task force in the DEA office in New Bedford. Our police department's ramped up interdiction, recovery coaches, clergy ride-alongs, CCIT teams. It runs and appropriate messaging, age-appropriate messaging in our schools, because you have to emphasize that for obvious reasons. One place that we have struggled, and Marty Martinez and I saw one another over in Cambridge at an NLC event. What was it, about a month or so ago? We were one of the presenting cities there, and one of the things that we find challenging, and I'll just throw this open, is the recency or lack of recency and accuracy in data that would be useful in helping us make our approach more granular. The approach has to be granular. You have to identify who's at risk, who's already established themselves as being at risk, and obviously those who've already overdosed are the ones who stand out. But even tracking them is difficult. Tracking the so-called super users, the people who bounce back and forth and who ultimately are going to die if somebody doesn't get a hold of them, is hard. You know, we find that emergency room data, and I think, by the way, Nusha, your quotation from Mayor Bloomberg up there was appropriate. Much of the data emerges when someone either is in an emergency room or they die, right? So, we have, and the data that we get sometimes is 3 or 4 years old. It's the methodology varies. Like, so if someone from New Bedford, goes to Providence and overdoses there, it's treated as a Providence problem, even though the problem's really a New Bedford problem, or vice versa. So, we're trying to work through that and to try to get everybody who's involved in the effort on the same page in terms of how they just track information. And as much, and I believe me, I think the stuff that you guys are doing are going to be part of it, Marina and Nusha, but I think there's also a need for other data sources that are assembled in a way that's consistent, in a way that everybody understands, and there's a level of communication about it that helps us. And so I throw this open to somewhat of a, not as a rhetorical question, but a comment, and just a request if anybody has any particular insight on how to do that well, because we are struggling with it. I'd love to hear it.
John, I think one of the things we can do with this is take the information back. Our Office of Recovery Services here and work with the conference in trying to figure out, every state collects data in a different way. For years, a lot of deaths went as heart failure and other types of illnesses when it really was overdoses. And still today, I think there's a lot of families who don't want to admit the fact, or don't want to say that their loved one died of an overdose. So they describe it a little differently. So I think I'd love to work with Jen and Brendan from my office with the conference and really look at, is there a national standard policy that we can do and figure. I think Mike Botticelli, when he was at the Bureau down in Washington, was trying to come up with some standard policy for the country. So I'd love to maybe talk about what we can look at and try and get the information, if that's helpful. I don't know if anyone else wants to comment. Yeah.
Just as a quick follow-up, one model that we have operating really well is in Plymouth County, Massachusetts. They have all 27 towns. Mayor Carpenter could talk about this too, but basically it's a law enforcement database where all the communities put data in real time. So every non-fatal overdose, every fatal overdose, every at-risk referral is put into this law enforcement database. And it's also a management tool that would trigger an overdose follow-up visit, a home visit with an outreach team. So their model works really well because it's real time and it activates this automated follow-up system. So I'd be happy to chat more about that. One of the things that they found as well is that about 40% of people overdose in a town that they don't live in. So without this cross-jurisdictional collaboration, that 40% of people are actually slipping through the cracks and would not get an overdose follow-up triggered in a traditional system where you're just thinking about your own community.
Another really interesting data point was the fact that the city of Arlington chief figured out that it's quite predictable who the next overdose death will be, which is the most recent overdose save. So they send outreach workers within 24 hours to the home of the user. Also, when they're ready to take down a drug dealer, when they get the phone and the computer and the client list, they go to the users after they arrest the dealer and say, rather than find a new dealer, and you don't know what you're going to get, how about getting into treatment? And they send a clinician and an officer to the home of the user, and if they're not ready, they leave Narcan with them. So it can help save their life until they are ready. And we've seen a lot of trust built and a lot of people come into recovery that way without arrest at their home after an overdose or after a dealer has been arrested.
And that's in our toolkit. So many cities and towns have used that. We have it in Boston, Police and Fire do the follow-ups, but a lot of other cities do it as well. So two things I just want to say. Make sure if you want the toolkit, we'll get it to you. We have it here today. And use that toolkit. And two, if you're doing something creative in your town, like putting a notification in the window of a police station, which I don't know if it's in the toolkit, but we have to get that in there. I think we be continually sharing best practices on that stuff because that's so important. And I'll just turn over to you a second, Mayor. And Mayor Mitchell's point is absolutely accurate. there was a study came out in Massachusetts this year that said overdose are going down in Massachusetts. I think it's a fake stat, and I just think we have to be very careful, because when I talk to the superintendent on police issues or the police department, every single arrest just about is drugs or alcohol. When I talk to Sheriff Tompkins, every single person that's in jail is drugs or alcohol. So I don't see it going down, and so when you talk to the law enforcement, you find out clearly. Yeah.
Yeah, I would just say, one of the things we did do recently was we charged a drug dealer with first-degree murder. We matched the toxicology report from the heroin and the person that died. Of course, the person made it real easy for us. He was videotaping him shooting the heroin in them and then raping them and sending a text message saying, "This is good stuff, it'll kill you."
Yeah.
So the grand jury indicted him.
Yeah, that's a good one. I'd like to ask if just for a moment, if the recovery coaches could please stand. I'm going to swear them in. This is the first time that I think it's ever happened. So.
Everybody look up here. Oh.